In this edition of the Maximize Your Medicare podcast, the Bennett's Act, a new act to help ease the controversies over enrollment in Part B, as well as my interview with radio guest show host Art Lewis on WSGW, something like my 20th appearance.
Medicare can seem confusing and scary, but it doesn't have to be. It's true, Medicare has complicated rules, a new language, and possible penalties. There are a dizzying number of options. The great news is that you can benefit from Medicare rules if you have unbiased expert guidance. Get your free guidance from J.O., a nationally recognized Medicare expert and author of the best-selling Maximize Your Medicare. Call the number on the screen today.
Welcome to the Maximize Your Medicare podcast. My name's J.O. I'm your host. I'm the author of Maximize Your Medicare. The 2020 edition is available on Amazon.com. What else? You can also get it from your local bookstore. Just call them up and order it. They'll be able to get it to you in days. The official website for the book, www.maximizeyourmedicare.com. There are official links there so that you can find out other important information about Medicare enrollment, as well as what Medicare covers. Go there, www.maximizeyourmedicare.com. In today's podcast, an update on the Bennett's Act, a new act which is slowly making its way through the Congress, as well as an interview with Art Lewis, where I was his guest on WSGW. You know, Art has been very, very supportive to me over the years. He actually interviewed me on the first edition of the book. And what happened is I was supposed to be on for an hour out of 2 of his hours. The guest for the second hour canceled at the very last minute. He looked over at me and said, "What are you doing for the next hour?" And I said, "Well, I'm here with you, Art." That began, and since then, at least twice a year, every single year for the past 8 years. So I think it's almost 20 in total. There's one notable development over the past week, and that is that there's something called the Bennett's Act, B-E-N-E-S Act, and it is slowly making its way through Congress. What this would do is this would change the time that you can enroll in Part B. Let's say, for example, you did not enroll correctly. You have a late enrollment penalty. That, some of this has been happened by mistake. People didn't know all of these, complicated enrollment rules. What they would do is make the Part B enrollment period the same as the annual election period, which runs between October 15th and December 7th. In addition to that, what it would do is it would reduce the delay of when your Part B effective date actually begins, which means that, let's just say, for example, you turn 65 in February and you don't enroll until, April. Now that's possible, right? That is possible to do that because that is still within your 3 month after the month of your born. However, what happens for that person, so remember, your birthday's in February 3rd, and then you don't enroll in Medicare Part B until April 1st. What normally happens right now is there is still a 2-month delay. In other words, your Medicare enrollment or your Medicare coverage date does not begin on May 1st. If you signed up on April 3rd, what happens is you would have this delay of 2 additional months. Well, this Bennett's Act would eliminate that. This can be important, and these little facts are more and more important over time because what happens is people are working beyond 65, or they're saying, okay, well, and then they're trying to preserve coverage for their spouse, for example. The number of combinations like this is increasing, and that's why I bring it up. The Bennett's Act would be helpful for those persons who either have missed their Part B enrollment date because it would be less confusing as far as when to actually enroll in Part B. In addition to that, It would also help those persons who are newly turning 65 and trying to time their retirement with Medicare enrollment. Without any further ado, I'm here with Art Lewis, and this is a recording of an interview that I had with him on a local radio station. You know, Art is very experienced radio show host, something like 57 years in total from the time he was a young man. He's now 77. So he understands the world of Medicare. And so that's part of the reason that our conversations are always, very, very fluent, very, very good and topical, because it directly affects him. He knows the topics that are under consideration under Medicare.
Chance to ask your questions and express your opinions from around your block to around the world. The Art Lewis Show is on 100.5 and 790 WSGW and online WSGW.com.
Good morning to you and welcome. Welcome to the Saturday edition of the Art Lewis Show here on WSGW. My guest today, been absent for a while, but he's been busy with his book, Maximize Your Medicare, because it's gone into, I guess I would call it national syndication. We'll talk about that. And we say good morning to Jay O. Morning, Jay. Morning, Jay. Where's Jay? I haven't heard from Jay.
I'm here, Art. Sorry about that.
There you are. Listen, I reminded you the other day, Jay did an interview with me, a video interview, and I was the guest. I warned him that paybacks. Anyway, listen, Jay, I have to ask, with the book Maximize Your Medicare, from the time you first wrote the very first edition a number of years ago till now, how much has Medicare actually changed?
Well, I think it's the 8th edition this year.
Wow.
The changes are actually notable, not because Medicare Part A, Part B, the enrollment rules have changed. That has not changed. But what has notably changed is the fact that people are working beyond 65.
Yeah.
Due to the fact that full retirement age under Social Security has increased. Just by that fact alone. So it's
but yet
the
Medicare age hasn't changed, has it?
No, it hasn't changed. So you've had this very peculiar set of combinations being introduced into the world, which is people used to retire at 65, get full Social Security, and go on Medicare simultaneously. Now that the cards have been shuffled, which is people work beyond 65, they delay Social Security, yet Medicare eligibility has stayed the same. So now this has introduced a lot of different combinations. And the book has had to adjust with that set of, changes.
All right, let's talk about a couple of things very much in the forefront of our minds these days. Let's start with COVID-19. How has Medicare addressed that issue?
Well, from people under Medicare, much of the negative surprises that people face don't actually exist. So under Medicare, if you are requiring a test, a COVID-19 test, that would be without copay, without cost. Now, I would urge a word of caution, which is that it's going to be important that you have a written kind of prescription for you, if you will. For the
In other words, a
You have
referral.
to be showing, right.
Yeah.
Just driving up to the testing site and kind of paying out of pocket and then hoping that Medicare will pay, that probably won't be successful.
Yeah.
But, for example, Medicare Advantage plans, waiving the testing, as long as you have, like I said, a written direction saying that you're exhibiting some symptoms where COVID-19 tested, is important.
All right. You brought this up, so I'm going to tackle it now. I was going to tackle it later, but since you mentioned it, compare Medicare Advantage plans, which are Part C they call them, I think. But compare Medicare Advantage plans to having regular Medicare A and B, a drug plan D, and a supplement. What's the difference?
Right. Sure. So under COVID-19, especially under, extraordinary circumstances here, the differences do appear, which is that the testing for COVID-19, if you exhibit symptoms, are going to be covered. That part I'm quite convinced, meaning whether you have Medigap or even original Medicare, just Part A and B and D, or under Medicare Advantage, the testing itself is not going to be a problem. That should be costing zero. Once you get beyond that, however, now the nuances start to exhibit themselves. Under Medigap, which are called Medicare Supplement or Medicare Supplemental, three terms that mean the same thing. Let's just say, for example, a complication exists, meaning you're exhibiting COVID-19 type symptoms, but then they find out that you had a pre-existing condition which had creates a complication.
Type 2 diabetes, for example.
Correct. You maybe had a respiratory complication in the past.
Okay. Respiratory, all right.
Yeah. And in which case, Medigap, again, is going to be fine. Meaning that the doctor decides, we need to check out some other ripple effects. Those are going to be covered by the combination of Medicare and Medigap. So completely covered. The issue is under Medicare Advantage. Because now, I spoke quite carefully and quite specifically, intentionally so, because the nuance is important, that the test for COVID-19 has $0 copay. But that doesn't mean the test for the ripple effect has a $0 copay. For that test, meaning other diagnostics, other services you may receive for these ripple effects, that could be subject to a copay, coinsurance based on your Medicare Advantage plan.
Yeah. The Medicare Advantage, would I be safe to say that while they're attractive dollar-wise, some of them don't cost anything, according to the advertising anyway, that they're more restrictive in who your doctors are, where you get your service, etc.?
You touched on, what is the difference from the first edition of Maximize Your Medicare until now. The tremendous difference, and especially in the local listening area, is that many of those perceived restrictions have declined. Because you're absolutely right. The advertisements are not wrong, not specifically wrong, meaning that are there $0 Medicare Advantage plans available? You still have to be enrolled in Part A and Part B. You can't get away from that. But can Medicare Advantage plans cost zero? The answer is yes. And can they be PPO? Which means that any doctor that accepts federal Medicare will accept the plan. The answer to that is yes as well. The issue is math of money, meaning that you can get a bill, a copay bill, for the ripple effect to COVID-19 diagnostic test.
Okay. So it's not 100%.
Correct. So under Medigap, you don't worry, candidly, because between the combination of Medicare and Medigap, you're going to be covered.
Yeah.
Without cost. Under Medicare Advantage, every Medicare Advantage plan will have its own specific schedule of costs that you may be assessed.
All right, hang on, Jay, hang on. I got to take a break. Okay, we are talking to J.O., the book Maximize Your Medicare, now in its 8th edition. We'll tell you I can get a copy of that later on. And we'll be back. If you have any questions about Medicare, by all means, give us a call. Saginaw, Bay City, 752-6111, toll free, 866-790-WSGW. We'll be back with Jay after these notes. All right, we're back with you here on the Saturday edition of the Art Lewis Show, talking to J.O. He has authored the book Maximize Your Medicare, among some of his other attributes. He's got a list of initials after his name longer than my arm. And we have Larry in Saginaw on the phone with us. Larry, you're on with Jay. Good morning.
Good morning. My question, Art, is with the new auto insurance laws, what do Medicare and Medicare Advantage cover? Are they primary or secondary in case of catastrophic accident? I heard that, Art.
Yeah, you beat me to the question, so go ahead. Jay?
Morning. Thanks for the question. Very complicated for Michigan, and a question we've faced a number of times. Medicare is pretty clear, secondary.
Okay.
Secondary. Okay, so you're going to want to be careful. The idea, I tell persons from a financial planning point of view, that when you are in the middle of a crossfire amongst insurance companies, I urge caution.
Okay.
So
let me
I
ask,
understand that you can go ahead.
Yeah, let me ask this question, because we are now led to believe that you can drop catastrophic and PIP coverage in your auto insurance because Medicare will become primary.
What I'll do, Art, rather than sticking my own opinion here, is stick to what Medicare guidance actually is, and I will supply kind of the link. There's a resource where people can go online. Medicare is addressing this specifically for people, and especially with the change in Michigan auto insurance laws. I'm not a person dealing with auto insurance specifically, and so I don't want to be stepping on someone else's.
Yeah. I've already had my session. Yeah, I've already had my session with my agent. Larry, you too?
Yes, and also there's a guy named Drew who works for the Michigan Government Insurance Agency, and he's excellent with it. He told me the same thing, that Medicare and Medicare Advantage programs are secondary.
Yeah, unless you don't have coverage on your auto insurance. What happens if you don't have coverage on your auto insurance? Then I think they do. I don't know. My agent told me, don't worry. He said it's primary. I said, okay. So, I was going to ask Jay if there was a change. Yeah.
You can hear it here.
Okay. Appreciate it. Thank you, guys.
I always tell persons that when it is exceptionally complicated in dealing with primary and secondary payer, even on health insurance. So the idea that you switch types of insurance leaves consumers in a very uncomfortable spot. And you can just hear it. We have your own data, Art, the caller's data.
Yep. Oh,
immediately.
Yep, I understand that. But I noticed that in all of the papers I read, I even have a white paper on it, they were all saying that Medicare A and B holders can drop the PIP because they're covered. So who knows? I mean, I would hate to think the public has been misled into dropping coverage and find out nobody's covered. I wouldn't think that would be reasonable. but you never know. Jay?
I try, because I'm not an auto insurance person, I try not to step on their field of play, if you will.
Yeah.
I can say that what Medicare has said, and I will be happy to provide whatever information on what Medicare is saying. That is no problem, of course.
Okay, fair enough. Larry, thanks. Appreciate it. Take care. So I guess, this is an issue facing everybody. I mean, because the law changed in Michigan, and a lot of folks over 65 who are Medicare A and B users have been told this is what you can do. And every insurance agent
conflicting.
And every insurance agent's following the same protocol. So it'd be a real mess if it turned out it wasn't true.
I think for persons that are not Medicare, even you'll hear insurance agents, and I just me as a private citizen, kind of reading what their opinions are, as well as from audit companies, et cetera, that changing the PIP parameters, if you will, can have unexpected results based on, because before unlimited and now you have these dollar amounts, et cetera, and whether or not there's going to be civil litigation, increases, et cetera. It just goes to highlight that when two types of insurance start to conflict with one another at all, it's just very complicated for the consumer. Very, very complicated.
Wow. And sure, all you have to do is try and read one of your policies to know that.
Crazy people write books about that kind of thing.
Yeah, gee. Yeah, I guess. Let me go on to a different topic here, because it was announced a while back that one of the supplement plans, F, was going to disappear, and that's the one that covers everything. I mean, that's what I call the sleep well at night supplement, because all of the co-pays and everything are covered, but that plan was going to go away. Did it?
Yes and no. So,
of course.
if your Medicare card is effective prior to January 1st of this year, Medigap Plan F is still available. For persons who are newly turning 65, meaning that if either of those Part A or Part B is January of 2020 or after, the next plan that looks most like Plan F is Medigap Plan G. Medigap Plan F is not available.
What was it about that? What was it about that plan that they made it go away?
Well, I think the number one thing is that Plan F covered the Part B deductible. That is literally the only difference between Plan F and Plan G. And while it's impossible to speculate exactly the reason, you can understand that it lowers the burden on the government to have to pay for the $198 Part B deductible. Therefore, kind of making the person more responsible for their own use of healthcare services, as well as, limiting the amount of redundant medical services. So it's solving for hypochondrosis. It's also solving for come in for your monthly MRI, at the extreme.
So let us say you're a person who has regular Medicare and you have Medigap F, Plan F. Mm-hmm. And let's say you want to keep Plan F, but you want to change carriers. Can you do it? Or is changing carriers considered to be brand new?
It would be in Michigan. It is considered to be brand new. So you need to pass medical underwriting.
Okay, I don't mean that though, but would I have to go to Plan G or could I keep Plan F with a new carrier?
You can stay with your Plan F forever, meaning that no one can eject you from Plan F for any reason.
But they might require medical underwriting.
If you wanted to change carriers,
yeah,
you can go to a different carrier for Plan F today, but you would be asked medical questions in Michigan.
Okay. So, sometimes you're better off not stirring the waters and just keep what you got.
Well, I would put a limit to that, or I wouldn't say that 100%. And the reason is that the difference in premiums can be notable, meaning that carrier number one, and the difference in carrier number one and carrier number two can be many hundreds of dollars a year. So for those persons in the listened audience who are in good health and would like, just out of prudence, they like Plan F, they want to stay with Plan F, but they want to save this multiple hundreds of dollars, it can be worth to check where the premiums are and then still hold on to their plan. Of course, you never cancel in advance, but you then see if you can get accepted to a new carrier and get the lower premiums. That is absolutely a viable strategy for anyone that's on Medigap of any plan.
So what are some of the disqualifying health issues? For example, at least a third of America is walking around with type 2 diabetes. Is that a disqualifier?
Type 2 diabetes by itself is not likely to be a disqualifier. What carriers are going to, and you waded into a ripple effect of COVID-19, which we'll get to, which is that the type 2 diabetes by itself, what carriers are going to be focused on is to make sure that your situation is stable, so that your medications aren't moving around month to month, every 2 months, every 3 months. And this is on any medical situation. Hypertension, for example. They're going to want to see that it's under control and that it's stable. Because as you know, if you declined everyone that had type 2 diabetes in the United States, I read something that something like 1 out of 3 Medicare beneficiaries have some type of diabetes, which is 20 million people in the U.S.
Hang on, we got to take a break. We're talking to J.O., the book Maximize Your Medicare. And if you have any questions, you can give us a call. More coming up. All right, we're back with you here on WSGW talking to J.O., his book Maximize Your Medicare. And Rick is in Saginaw. Rick, good morning. You're on with J.O.
Good morning, Art. Good morning, Jay. Do you still recommend the supplement plans over the Advantage deals if you can afford it?
Well, I think that it depends on, obviously, a number of different moving parts, but certainly for persons under Medigap, the point, what you're paying the extra premium for is its stability. Contractually, health insurance is a financial contract, ultimately, that Medigap has no moving parts, that you're paying extra premium for the fact that you know that your coverage will never change over time. The premiums may change, but the coverage is known. Medicare Advantage is certainly attractive because its cost is notably lower, well over $1,000 a year lower as far as premium. That said, inherently, Medicare Advantage is an annual contract, meaning that the moving parts move. So it's up to the person on whether that fits their budget, their health situation, because certain persons just don't require healthcare services. They've won the DNA coin flip overwhelmingly. Now, I guess the last point to this is that switching from Medigap to Medicare Advantage is a free option. You can switch every year during the annual election period. Art and I have, convened every year in the autumn so that people can know this. Switching from Medicare Advantage to Medigap is subject to conditions which can include your health situation. There are exceptions, but in general, beyond the age of 65 and a half or after 6 months after you retire, if that window has closed, then the Medigap sellers, insurance companies, do have the right to ask you your medical history. And under COVID-19, the issue for me, the new issue over the past month is we're not exactly sure how insurance companies are going to be judging the fact that you've been exposed to COVID-19, etc. Whether how that underwriting question is going to actually change in the era of pandemic. It's an important thing, and this is something that I've highlighted in Maximize Your Medicare a number of times, that once your guaranteed period where every Medigap carrier must accept you expires, then you've kind of lost control of the underwriting process. And now we have a notable big X factor, which is COVID-19.
Different question. I switched pharmacies. I'm newly type 2 diabetic.
Okay.
Should testing supplies, the strips and the lancets with a Plan F be completely covered?
Should be yes.
Okay.
Because it'd be durable medical equipment. So as a result, the answer should be yes.
Yeah, I did it when all this blew up and just over the phone, and they couldn't make it work. So I just paid what they wanted, but I got to go in there and get it straightened out because I thought it should have been covered completely.
We should point out, Jay. We should point out too, just to clarify, the equipment itself is under durable medical equipment, but typically Plan F does not cover overages and prescription cost, right? It does not address Part D. Is that correct?
That is correct. So if you have Medigap, yes. Sounds like the caller does understand this distinction, but for the general public, you're absolutely right, Art. It's a good point, which is that Medigap is covering your medical services under which durable medical equipment fits, meaning walker, for example.
Right.
The prescription itself, metformin, for example, which would be the generic medication for diabetes type 2, that is covered by your prescription drug benefits, which can be Part D or embedded in many Medicare Advantage plans.
Right.
Now, to your point specifically, one thing I would like to add, which is that you can have controversies at certain instances. But I just want to be very, very clear because it's a misunderstanding. And, of course, Jay's to blame, right, when this kind of thing happens, which is that this is frequently the issue of administration and billing, not because the carrier doesn't understand its responsibility of payment. That once this information is transmitted to the carrier, your Plan F Medigap carrier, they don't have any choice. They don't get to just pay or not pay on a discretionary basis. If Medicare Part A and B is the primary payer and they make their payment, Medigap carriers, they must pay for the 20%, or under Part A, the inpatient hospitalization deductible. and the 20 days, and then 21 through 100, depending on your Medigap plan. So they will make the payment.
Yeah.
Usually controversies are because of administration.
So follow it up, Rick. Get it straightened out.
We got a good loaded question here for you.
Real quick, because I'm way late for a break. Go ahead.
For the Advantage plans, the government is paying these companies to do what they do.
Yes.
How much is the government paying these companies?
I don't have the figure off the top of my head, but it is publicly known. And they do publish this amount. It is increasing. Part of the explanation on why Medicare Advantage plans have improved, there are two big reasons. Number one, that per diem that you mentioned has increased over time. And number two is the intense competition amongst Medicare Advantage carriers. The biggest, the brightest, with unlimited computing power are certainly trying to get higher percentages of people in Medicare Advantage.
All right, I got to take a break. Rick, thank you. Appreciate the call.
Yeah,
We'll be back.
Are they getting one?
Rick, I got to go. Rick, I have to go. I got to take a break. I'm late now. All right, we're back talking to J.O., authored the book Maximize Your Medicare. And before I forget, we could go the whole show without me asking, how does one get a copy of the book if they're interested in reading Maximize Your Medicare?
The official website for the book is maximizeyourmedicare.com. Just like almost anything on the planet, it is available on Amazon.com, of course. Just type in Maximize Your Medicare.
So it is available.
Absolutely, and your local bookstore will be able to order it if they don't have it, or to the degree that you can actually get to your bookstore under the pandemic. But that is possible.
So this is edition number 8, you said. Is that correct?
That's right, Art. So what's different is it has been in self-published form for the first 7 editions. And then this past year, the development has been a publisher asked whether or not they could take over the publishing of it. So that has, of course, increased its distribution around the country.
And have you seen that? See copies selling?
Oh, absolutely. And, most notably, multiple hundreds of libraries around the country have adopted the book. Absolutely. Which is what I really envisioned, which is I realized that people go to the library to get a resource for information. It is the logical place, absolutely.
So are there any changes on the horizon for Medicare that have been announced or at least speculated on?
I think the one we touched on it previously, which is that insulin copay is going to be limited next year in 2021 to $35 a month per prescription. And that is true under Medicare Advantage or under Medigap. Or, sorry, not Medicare, Medigap Part and having Part D. So under Part D or under Medicare Advantage, the prescription benefits portion, the monthly copay for insulin capped. So
they're trying to force the prices down? They're trying to force the prices down?
And that follows a trend. In other states around the country, we have seen legislation on a state-by-state basis which has limited the copay for insulin. So that's going to be a very welcome development for many.
So, but, if they limit the copay, but the insurance companies don't reduce the price, it's going to cost people more money, isn't it, in the long run?
From what it appears, and it's still a little bit early, I've asked this question of others, just as you have, Art, which is, where's the money coming from? And apparently, it's coming from two things. One, which is largely the discount from the drug manufacturers is the primary source. Is there going to be a slight amount coming from the plans itself? But apparently that amount is small. That is what people who know a lot about the way these are designed has informed me. One other last thing I might point out is that even if you're in the coverage gap, the $35 a copay still in effect, which is going to be very important.
All right. Well, like always, we run out of time in this discussion with J.O. The book, Maximize Your Medicare, and that's the website, maximizeyourmedicare.com. All kinds of things you can do on that site, including asking Jay questions. And we look forward to chatting with him again in the future. Jay, thanks a lot. Appreciate it.
I missed you, Art. I thought I did something wrong. Nice to be with you again.
Nope, you didn't. It is more fun in the studio where we can look at each other face to face. We talked about that the other day, but you do what you have to do, my friend, right?
Absolutely, that's what we'll have to do, and I appreciate the time, Art.
All right, we'll talk to you soon. Thanks a lot. Bye-bye now.
Thank you.
J.O. with Maximize Your Medicare. By the way, it's J-A-E, and his last name O-O-H. That's simple. We will be back to close out after these notes.